When Beth Marchant was 32 and breastfeeding, she found a lump. She did an ultrasound, then got a notification from an app called Pocket Health the next day.
Just an automated, like, hey, your results are ready. Like, that's not how you want to find out that you have stage 3 breast cancer.
It triggered repeated frantic calls trying to reach her family doctor and led her to frightening Google searches.
I looked and I'm like, oh my God, I have like a 50% chance of dying within 5 years. Like, as a mom of 3 with a 6-month-old baby, like, that's horrifying.
In a different city, on a different health app, a similar experience.
And I clicked on it, and then that's when I saw invasive ductal carcinoma, grade 2. My world stopped.
Learning you have cancer can be traumatic. Doctors say learning it from an app doesn't help.
That is not the right way anyone should find out a diagnosis.
The hospitals have a responsibility to work with patients to prevent these kinds of events from happening.
Hospitals across Canada have a mishmash of policies. Some put the onus on the patient to decide which test results they want to get online.
Providing patients with real-time access to their data reduces the anxiety of most patients.
It was extremely hard.
That wasn't the case for Janelle Johnson.
I was devastated.
She got her diagnosis on MyChart, one of the most widely used patient data apps in Canada.
To see it that way, it was like a gut punch.
The company behind MyChart says hospitals can tailor the platform to hold back results of certain tests until a doctor gives the green light. But not all hospitals do this. Doctors and patients say that needs to change.
To get that kind of news and you're by yourself, it's difficult to handle, it's difficult to stomach.
Now, when Johnson gets a scan to see if her cancer has spread, she doesn't open the app until she hears from her doctor. Mike Crawley, CBC News, Hamilton, Ontario.